All right, everybody, welcome back to Direct with Dr. Couch, and we're here to talk more about the broken healthcare system and the things that I know about it because I'm a doctor that left that system. And what we're here to talk about today is this idea, this concept: healthcare does not equal health insurance does not equal healthcare. They are not the same thing. So we're going to unravel kind of the difference between how we've all been kind of convinced and opted to understand these things go hand in hand. And without being overly political, there's a lot of national discussions for the last really since 2008 and before, certainly about what healthcare coverage would mean to increase the health and the wellness of a general population. But we're here today to kind of illustrate how that is not so simple. And on top of that, when we look at more of an individual level, we can really start to unravel why the pain points that people are experiencing in today's modern healthcare system in America are actually stemming from not just their keeping coverage from a health insurance company, but how the whole system has really just morphed into this large conglomerate of interest for the insurance companies. So, what we really probably should start with is, what does the system look like now? And we've talked about this a little bit on this channel, talking about like, why does my doctor only want to or seem to want to or get to, maybe they want to help, but it feels like they only get 7 minutes, and it feels like they're rushed, and it feels like we don't get anything accomplished at my medical visits. What's driving that? Well, we've talked about how that occurs, and what we need now to do is peel back the layers as how the insurance contributes to that. Which insurance, it's the de facto. But everybody's still confused about what that insurance plan is supposed to do for them. And over the last several years, as deductibles have gone up and premiums have also gone up for your higher deductibles, you could end up paying thousands of dollars a year out of your own pocket. They kind of trick you. It's kind of not out of your pocket. They take it out of your check and the massage it and the money around. But nonetheless, deductibles are up, premiums are up. You're paying thousands of dollars a year out of your hard-earned money, and you're still on the hook for medical bills. So people start to go, what's going on here? I thought this is why I paid for insurance. I thought I was supposed to have healthcare access. I thought I was going to see the doctors I wanted to go see. I thought it was going to be easier to navigate the system. I thought it was going to be cheaper to navigate the system because I've made a decision to pay into that. And if that may have been the case a long, long time ago, we are quite far away from that now. And what this basically makes us all start to harken back to is this idea that insurance is a financial tool. We're all familiar with insurance in other ways for other products. Um, this idea that life insurance is something that you pay into and expect to, you're personally never going to use it, but you hope that it benefits somebody. You're hedging your bets against catastrophe. You have car insurance in case your car gets totaled. You're hedging your bets against catastrophe. Should I find myself with a bill or no car, or somebody hits me, I'm not on the hook for thousands of dollars at one time. Instead, I've paid thousands and thousands of dollars into a insurance plan over time, so then I can get that back out. That's essentially what insurance is. And healthcare insurance is really no different than that. But what the system has done, and the financial incentive structure that existed for a very, very long time, has conditioned everybody to think that every single medical expense in the system should be run through your healthcare insurance plan. And what that really does essentially is take this thing that should have been, I'm slow money away into a pocket, a pool of money, health insurance, so that when I need a big bill that otherwise I wouldn't be able to foot with cash on hand, what we've done, instead of making that a small payment, is, I won't say bad actors, but there was definitely some incentives for insurance companies, hospitals, doctors, corporate groups to run as many charges to that insurance to hyperinflate this price and come home with a lot of money. Now that's not been happening for a long, long time for most places, but that's how it used to work for sure. And now what's happened is every but the money's not coming back to them, so that's where everybody's frustration is coming. I'd be fine to pay a ton of money for this insurance product if I was getting out of it what I thought I should be getting, and that's not happening. If we think about the history of health insurance, this was actually started the very first Blue Cross Blue Shield plan, I believe is Waco, Texas. Don't quote me on this. There was a superintendent of schools there that said, "Hey, let's come up with I want to protect my employees. I want to invest in my employees, our school teachers here in Waco, and let's set up a program where we set aside some money every month in our budget as a school system that if you're a teacher in our system and you get sick for 2 weeks, we'll cover a 2-week hospitaliz up to a 2-week hospitalization. So then you don't have to worry about getting a big bill from the hospital." Now, this was like 1948 or something. I'm not sure that the big bill would have been what we consider to be a big bill. I don't know if you've seen some of those captions, those other old charges as like hospital delivery for a baby, $3.10 for Tylenol. So, uh, nonetheless, things were insurance was created to provide a shelter and a financial tool to protect the employees of this school system from getting a catastrophic medical bill up to a certain point. Now, if you were sick for more than 2 weeks, I don't know what they did, but that's what they budgeted for. Say, "Hey, we'll help out." And let's be honest, most people, if you got a free 2 weeks in the hospital, you're probably not using that all the time. So again, there's this large historical precedence for a little bit of money for a little bit of service that otherwise you may not have the money or the will to save for. And if you don't use it, that's fine because it's not costing us as much. But what we've got now is if we look at Medicare, Medicaid, private insurance, as these prices continue to go up because of a multitude of factors that's happened in the country, both politically, legislation, Affordable Care Act, a aging and sicker population, all of this starts now to drive the cost of care up, which means everywhere that we turn, whether it's taxpayers, Medicare, Medicaid, or if it's your employer actually sponsors probably most of your plan, and then you're paying like the tip of the iceberg. So if we're talking about taxpayers, your employer, or yourself paying thousands of dollars into these plans, you want something out of it. But instead, what are you getting? You're getting 7-minute visit. You can't get to the doctor when you want to see the doctor. You probably, I shouldn't say that. I shouldn't say probably don't like your doctor. You may not have gotten to pick your doctor. You may like your doctor. You may think that they're too busy and too overrun with patients. And when you leave there, maybe everything didn't get solved. And instead of it getting solved maybe 2 weeks later or on a text or a call, it gets solved at your 3 or 6 month or 1 year arbitrary follow up, and you're keeping a notepad till then. And guess what? The next time you go in there, it's going to be 7 minutes too. So you don't even get to hit all the issues that you've been keeping on your notepad. How do we get here? Well, here's how insurance makes the care worse. Okay. The first one is just a time compression. Okay. If insurance companies control the rate of reimbursement for a service and what the doctor can bill or charge for that service, we're in one constraint. Also, if it's not based on time and it's based on codes and complexity, it's a reasonable chance that we could hit 1 to 2 issues and increase my complexity for an insurance-based doctor's visit before I walk in the room. Says you're gonna refill your blood pressure pill, you bring up something else, boom, we're done. So, if that's how we control the time in the room, and then we're also making this a factor I have to be in a room and committing time to this patient in order to get reimbursed from the insurance company. These two things mean that now I have to stack my entire medical office front to back, full blast, double booked all day to see 20 to 40 patients a day, come hell or high water. Whether you've got a big problem, a little problem, a medium problem, boom, I'm on to the next room and the next door. It's hard to imagine, but that's actually a function of the insurance company. That's not a function of your doctor. That's not a function of your big corporate medical practice that has invaded your town or wherever you live. That's a function of the insurance company and the economics that drives how we deliver care. So that's number one. Number two is, on top of that, in order to actually get reimbursed for those codes you sent and get the referrals out to your, let's say, in-network specialists, now these offices have to acquire a huge team to just handle the administrative burden. You have a front team, you've got a call team, you got a referral, you got all these people, So now we're taking on increased cost at the level of the doctor or the medical practice, which is why all these independent doctors are selling out to large corporations, because now they can get this administrative burden off of their books and get some of that resources back from the large conglomerate. But nonetheless, they still have to mess with this administrative burden. They got to write the notes, or they got to pay somebody to write the notes, and then they got to send the notes to the insurance company, and then they're going to get their money back for the service they render in about 90 days, if they get it all. Go online, look at these videos about automatic denials from the insurance companies. One of the big five, I can't remember, and I won't say right off the top, but a couple months ago, they came out and said just straight up that they're denying every single claim automatically that comes back at a certain level of care and down coding it automatically. Doesn't matter what the doctor put, doesn't matter what they said or did. They're just going to automatically down code it and pay them less. And if you want to get paid more, then you got to challenge that. You got to go to them and say, I want more money, and here's why I should. So that's just insanity. That's total crazy town. There shouldn't be a doctor in the world that stands for that, but they have to, because they think there's not an alternative. I say over and over, every doctor in the world would deal with the mess that I just laid out. Everybody was happier, healthier, richer, and our country was getting better. But unfortunately, it's like the doctors are over here doing all of this work and committing all of this sacrifice monetarily and time-wise at the expense of the quality of care for the patients. All of them got into medicine to help people build relationships, take care of people, be on the horn, be available, and get to use their unique gifts and talents physically with surgeries or procedures, or cognitively to help people be better with their health, their wellness, cure disease, whatever. That's not happening right now. So we have this tension. The doctors are under this tremendous amount of tension because their daily actions in the system are inconsistent with their dreams, goals, passions, gifts, aptitudes of like relieving as much human suffering as possible through physical and mental ailments. Okay. So that picture gets pretty bleak. And some of y'all get offended. I think I said this in the last video. The only good doctors left in that system that are taking care of you and listening as long as you want to are doing it for free. They're doing it out of the goodness of their heart. I understand that's the duty of the profession, is to take care of people. But the reason you're getting not so happy and helpful care at insert medical office here is because they're taking insurance. The whole system is just an economic model that has put doctors in that box. And the only way for them to give you high quality care is to do it for free at their regular insurance-based office, or totally leave that system and create a win-win situation for the patient and the doctors. Okay? That win-win situation is called direct primary care. That's what we do here at SWVA Direct Primary Care. We've been doing that for about 4 years. And a lot of people go, I wish my doctor did this. Oh, I wish. This is a movement that has to be the doctors and the patients together have to acknowledge and understand that health insurance does not equal healthcare. Healthcare is service, duty, relationships, person to person, doctor to patient. The insurance has gotten in the middle of that and totally eroded the fundamental fabric of how we should deliver healthcare. The only way to leave that is for the doctors to be bold enough to say, come hell or high water, I'm leaving the system and I'm going to deliver care on my terms that I know people would get better and healthier and do for less money when we remove the insurance company. And the patients have to be honest and recognize I cannot continue in good faith to every single year pay more and more and more for health insurance that serves me little to no purpose. If your purpose is to maintain a product, protect you and your family from medical catastrophe, you've got a lot of options that are not buy into the HMO or PPO low deductible plan that your employer is offering or that you could buy on the healthcare marketplace. The doctors have to lead that, and the patients have to acknowledge that they're getting totally ripped off and things are going to get worse and worse. Not trying to be a doomsday here, but things are going to get worse and worse if the doctors and the patients don't walk in stride and say we have to leave the idea and the concept these health insurance companies are here to help us. No, no, no. Health insurance is a financial tool to protect yourself against catastrophic medical illness, and the rest of it is 100% easier, better, quicker, more access, more relationships, more communication, and more focus on you when you pay cash for your medical care. Okay? Direct with Dr. Couch. We will be back next week. Drop some comments below if you've got any suggestions on topics or questions that we can help you understand further. Thanks.